اللحظة الحاسمة اقتربت. إذا كنت تطمح لمستقبل طبي واعد في الأردن، فهذا الفيديو هو بوصلتك نحو النجاح.
1. A 55-year-old female presents with severe pain in the right upper quadrant after a fatty meal. Murphy's sign is positive. What is the most appropriate initial imaging study? 2. Which of the following is the most common cause of hypercalcemia in outpatients? 3. A 2-year-old child presents with a high fever and a distinctive strawberry tongue. What is the most likely diagnosis? 4. In the management of an acute asthma exacerbation, which of the following should not be used? 5. A 30-year-old male presents with a painful, swollen knee. Joint aspiration reveals needle-shaped, negatively birefringent crystals. What is the diagnosis?
6. Which of the following physical findings is most likely in a patient with pleural effusion? 7. What is the most common causative organism of urinary tract infections, UTIs? 8. A 40-year-old female presents with a painless lump in the neck that moves upward with swallowing. What is the most likely diagnosis? 9. What is the first-line treatment for a patient with symptomatic bradycardia? 10. A 25-year-old male with a history of 4 drug use presents with fever and a new heart murmur. What is the most important test to order? 11. Which of the following is a classic sign of iron deficiency anemia on a peripheral blood smear? 12. A patient presents with a moon face, central obesity, and purple striae on the abdomen. What is the most likely diagnosis? 13. What is the most common cause of small bowel obstruction? 14. In a patient with suspected bacterial meningitis, when should corticosteroids, dexamethasone, be administered? 15. Which of the following is the most sensitive marker for early diabetic nephropathy? 16. A 3-year-old child presents with a barking cough and inspiratory stridor. What is the most appropriate initial treatment for a mild case? 17. What is the most common site for an ectopic pregnancy? 18. A patient with a history of COP presents with increased sputum volume, purulence, and dyspnea. What is the primary management? 19. Which of the following is the most common cause of neonatal jaundice in the first 24 hours of life? 20. What is the recommended screening test for colorectal cancer for average-risk individuals starting at age 45? 21. A 45-year-old male presents with sudden, excruciating pain in his first metatarsophalangeal joint. The joint is red, swollen, and tender. What is the most likely diagnosis? 22. Which of the following is the most common cause of hyperthyroidism worldwide? 23. A 10-year-old boy presents with hematuria and periorbital edema 2 weeks after a throat infection. What is the most likely diagnosis? 24. What is the drug of choice for treating anaphylactic shock? 25. A patient presents with a curtain coming down over one eye that lasted for 10 minutes then resolved. This is known as
1. ما هو التصرف الأمثل للطبيب عند اكتشاف خطأ طبي ارتكبه زميل له وأدى إلى ضرر بسيط للمريض؟ 2. يعد السر الطبي ملكاً للمريض، ولا يجوز للطبيب إفشاؤه إلا في حالات معينة. أي من الحالات التالية تبيح للطبيب إفشاء السر؟ 3. في مهارات التواصل، ماذا يقصد بمصطلح الاستماع النشط active listening مع المريض؟ 4. عند حدوث ازدحام شديد في قسم الطوارئ، ما هي المهارة السلوكية الأهم التي يجب أن يتحلى بها الطبيب العام؟ 5. حسب أخلاقيات المهنة في الأردن، في أي حالة يسمح للطبيب بإجراء عملية جراحية لمريض دون موافقته الصريحة؟